And so this update comes as countries are racing to snatch up as many shots as possible. Now, a new report by the People's Vaccine Alliance shows discrepancies in which countries are getting shots, or access to the shots, rather. Now, some experts, they're calling this vaccine hoarding. Talk about what this means and which countries are the current culprits.
Yeah, Renita, I find this so fascinating. So the richest countries around the world are snagging up the majority of COVID vaccine shots, leaving behind lower income nations that could be behind for years in the race to get vaccines. So I want to dig into some of the numbers here that illustrate this vaccine hoarding. Canada, which we just chatted about earlier in the show, ordered 5 times the number of shots needed for every citizen, 5 times. They're at about 410% capacity of the vaccines that they need. The richest countries, about 14% of the global population, has already bought up 53% of vaccines, and 100% of Moderna doses have been scooped up by wealthy nations. Every single Moderna shot available has been scooped up by a wealthy country, and this is problematic for multiple reasons, Renita. One, of course, it's unequitable health care, right? But on top of that, public health experts have been very clear throughout this pandemic. This is a global virus and it needs a global solution for us to be able to move past it. Until the vaccine is available across the world, we're not going to be able to move past COVID-19.
So tell me something, is anything being done to address this unequal distribution of the COVID vaccine?
Yeah, so we're hearing from AstraZeneca, which is the manufacturer that's producing the vaccine created by the University of Oxford. They have really committed themselves to making shots available for lower income nations. And this is a really good thing because Moderna and Pfizer's shots have to be stored at these extremely low temperatures. So it's much harder to transport those shots than it will be to transport the AstraZeneca vaccine. Also, the People's Vaccine Alliance that created the report that we're chatting about right now, Renita, they are really pushing the World Health Organization to make COVID-19 vaccine trial data as public as possible so that as many people can contribute to the information gathering needed to create as many vaccines as possible.
And Maddie, in the minute we have left, tomorrow the FDA votes on whether or not to approve the Pfizer vaccine. It's expected to happen, I should say. And what can we expect to happen with these shots immediately following that vote tomorrow?
So public health experts originally said that the shots would be distributed straight away, which of course was very exciting. But now the head of Operation Warp Speed in the U.S. is saying it could take up to 4 days for these shots to be distributed following tomorrow's vote. And this, again, is very different from the data that we've seen from previous public health experts who said the vaccine would get doled out straight away. And every second counts with this virus. We're seeing that 2 people are dying every minute from COVID in this country, and 200,000 people are testing positive every day. So I can't stress enough what a dire situation we're in as we wait for this vaccine.
Every second counts indeed. Thank you so much for that report, Madison.
The biggest stories the moment they happen from around the globe. Subscribe to Bloomberg Quick Take now for insight in an instant.